Well, avoiding toxins, again, starts with education. You need to educate yourself about where these toxins are found. We know if they're putting certain chemicals in food, that may be something we can avoid. If we're eating organic, healthy food, that's going to have less toxins in it because they don't have the same level of pesticides or herbicides. Being aware of cosmetics, skincare products, shampoos, deodorants, all these things have various toxins that in small bits may not be a big deal, but if it's something you use every single day, over time your skin will absorb it, it'll accumulate in your body, and that can lead to ill health effects. Again, what you put on your hair, your shampoos, your conditioners, all of these things, again, can have a cumulative effect. And the fact that we're, over 80,000 chemicals the average American is exposed to over 80,000 chemicals per year, that's a lot. And out of that 80,000 chemicals, only 200 have actually been studied for their long-term safety.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. Many women receive a diagnosis that leads them to search online for answers. This often creates even more confusion. And some women are told they're fine and do not receive a diagnosis, but they know something is not right. A lot of this confusion can be cleared up when we address the root causes of hormonal issues and other health problems. To explore this further, I'm sharing today's interview with Dr. Darin Ingels, who is a naturopathic physician with a focus on environmental medicine and a special emphasis on chronic immune dysfunction. He's author of the Lyme Solution and host of the Allergies and Asthma Summit. On today's podcast, we're discussing how the gut microbiome, infections, inflammation, genetics, and certain environmental factors can be at the root of women's health issues and what we can do to find and treat these. You may be surprised to learn about the connection between hormones and these root causes. To learn how to get access to Dr. Ingels' full interview, plus over 50 others, go to hormoneseries.com. I hope you enjoy this episode of the Woman's Doctor podcast.
I actually started out as a clinical microbiologist and worked in a large teaching hospital in Chicago for 5 years and then went back to naturopathic medical school. And I've now been in practice for 22 years and I specialize in Lyme disease and chronic immune deficiencies.
Darin, what do you think women need to know about how to address health issues?
Well, I think what happens in medicine, and this has been going on for decades, is women get marginalized in medicine. They have so many different symptoms that they go to their doctor, they go to several specialists, and they get dismissed of having, neuropsychiatric issues, or you're just a mom, you're tired, and a lot of times they don't get to the root of the problem. So, what I try and help women do is find out what is the root cause of their illness. And often we find it can be any number of different things, including chronic infection. Sometimes it's some sort of underlying autoimmune disease. So it really is about, how do we really find the course of the problem and not just put a Band-Aid on the symptoms.
What impacts our mood?
Well, hormones and neurotransmitters are the building blocks of everything that creates mood. So whether we're happy or we're sad, all that's this inner network of hormones and cells and chemicals that have this beautiful concert that have to come together to make everything work correctly. And we've got so many things along that pathway that can be disrupted. That kink in the chain is what really causes the down effects to mood. So whether someone's feeling sad or whether they're feeling depressed, something along that line has been interfered with. And I think what's really interesting when we look at a lot of the research, and we've got this really tight connection between our gut and our brain. And we used to think that all these neurological issues or these mood issues were really just a problem with brain chemistry. And we've learned so much now that that's actually probably a very small part of it. It really is about how well our gut functions and our microbiome, and everything that happens with our digestion and absorption actually plays a critical role in how well our mood is and how well our brain functions.
What are some of the interfering factors in women's health and hormones?
Yeah, we need to look at the basics, and we need to look at people's diet. We need to look at all the things that are part of their environment. We have these things called endocrine disruptors. These can be chemicals, these can be chronic infections, all these things that interfere with normal hormone function. We know that all the chemicals that are going into our food supply, these are hormones from other animals. These are antibiotics. These are pesticides and herbicides. The cumulative effect of all these different chemicals on our own body interfere with the normal function of our hormones. Some of these chemicals will actually bind to estrogen receptors or progesterone receptors. And so our body and our brain thinks that we're getting estrogen or progesterone, but it's not coming from our own system. It's coming from something on the outside. So we have to take this overall view of everything that you're being exposed to in your life, from what you put in your mouth, to what you drink, to what you breathe, because all this is having an impact on how well your hormones function. And again, if you've got something disrupting that system, your hormones aren't going to function the way they're supposed to.
How do infections play a role in our hormones?
So chronic infection can also be an endocrine disruptor, and I think this is something that a lot of doctors tend to overlook in their practice. And this can be anything from something like Lyme disease. It can be something like mycoplasma or streptococcus. A lot of things that we get exposed to in our day-to-day world that we don't think much of, or maybe we think of only cause very specific types of infections, can become persistent. And as they become persistent, they can interfere with our thyroid. They can interfere with our adrenal hormones. They can interfere with our reproductive hormones. We have this epidemic of men with low testosterone. We have this epidemic of women with, high estrogen and low progesterone. What's causing all that? Well, infection can be part of that. And alongside of that, we'll see all this other collection of vague symptoms that, again, I think with women tend to be marginalized. They're tired all the time. They've got brain fog. Their mood has changed. And they go, well, yeah, that's just normal. Well, it's not normal. And if you've got this underlying infection, until that infection's adequately dealt with, you're going to continue to have these problems. So throwing birth control pills and antipsychotic medicines and SSRIs doesn't fix the problem. It only puts a Band-Aid over it. So we need to get to the root of the problem. And again, infection can be one of these sources.
What are ways we can address infections?
That's a great question. Well, I think when it comes to chronic infection, we have to ask the question, is it the infection or is it the terrain? And I think most of us in naturopathic medicine would agree it's the terrain. We all get exposed to bugs every day in our life. We get exposed to bacteria, viruses, parasite, fungi. These are a normal part of our world. But why is it you can put 100 people in a room, expose them to the same virus? Some people get sick, some people get no symptoms at all, and everything in between. The difference is the terrain. And the terrain is everything else that makes us us. That's our diet, that's our gut health, that's our immune function, that's our sleep, that's how we move our body. All of that impacts our terrain. So if our terrain is susceptible when we get exposed to these different microbes, we get this chronic or persistent infection. So part of it is that we have to recognize that it exists. So there are diagnostic testing available that we can help figure out what people have been exposed to. But more importantly, we have to look at, why is there a persistent infection? Why does somebody have chronic Lyme disease? Or why does somebody have chronic strep throat? Why do people get sick over and over and over? I think the difference is the terrain. So we have to take a deep look at all these things that impact our body from the inside.
How does the gut microbiome play a role in our weight and metabolism?
Yeah, well, I think the microbiome plays a huge role in weight and metabolism. Again, we have tons of research coming out about how important our gut microbes play a role in our ability to digest our food, absorb our food, and ultimately control all the other hormones involved in weight and metabolism. So again, this is a function of the kind of foods we're putting in our body, the kind of chemicals we're being exposed to the outside. We know that even medication and even certain supplements can disrupt that normal microbiome. So if we get that disruption that builds over the course of many years, and often we'll go back in people's history and find out this started when they were little kids, and over the course of decades, they eventually get to a point where the microbiome is so disrupted that their weight changes, their metabolism changes, their mood changes. We've now found that the gut's involved in pretty much every chronic illness, from heart disease to diabetes to chronic immune dysfunction. So it's really about, how do we get the gut back into a healthy state? How do we rebalance a microbiome if it's been disrupted? We know that antibiotics are probably the biggest culprit in causing disruptions to the normal microbiome, but we've now found that there are literally hundreds of medications that disrupt it as well, from heart medication to diabetes medication and so forth.
How can we get our gut back into a healthy place?
So getting our microbiome back to a healthy balance is a combination of we've got to stop the influence from the outside from disrupting it. So maybe we need to get people off certain medications that might be disrupting it. We certainly need to look at people's diet. If you're not eating a diverse diet, if you're not getting that breadth of vegetables and fruits and lean meats, all that gives that diversity of the different microbes, it's going to be harder to get that balance back. So we need to make sure that people are eating good, clean, healthy, organic food if possible. We need to stop that influence from the outside, and ultimately that's what helps rebalance the gut.
What do you think are the best foods for gut health?
Yeah. So some of the best foods to help rebalance your microbiome are just vegetables. We know that vegetables, because of the nutrient content, because of the fiber content, fiber is really the fuel for a lot of your gut microbes, particularly the bacteria in your large intestine. They need the fiber to thrive. We know that fermented foods have become incredibly important in rebalancing our microbiome. The fermented foods, things like sauerkraut and kimchi and even kombucha tea, can be very helpful in reestablishing our normal microbiome.
How do people know if they have issues with their gut?
Well, if you've got a disruption in your normal microbiome, you can get any number of different gastrointestinal symptoms. This can be anything from constipation to diarrhea, gas, bloating are extremely common, and just a kind of a chronic upset stomach. So for people who experience these symptoms, particularly if it's more than just a handful of days, that can be a pretty good indicator that something in your intestinal tract, particularly your gut microbiome, it may be off. Fortunately, we do have tests available that we can measure that, and the technology has changed so much now that we can almost map out our entire microbiome. So we're really at the forefront of understanding really much more deeply how that microbiome plays a role in chronic health. But I think we've just begun to scratch the surface on what is a normal microbiome. How many people do we know that have never been on an antibiotic and never had this outside influence of medication and eat natural, healthy, organic foods? I think in Western cultures, it's such a small population that we don't even know what a normal microbiome is anymore. So I think, again, the research is starting to come out and we're having a better understanding of what that is. So that's going to give us better tools to influence in the future.
Do you recommend labs to look at gut issues?
So I was a microbiologist before I was a doctor, and back in the day when you ran a test for gut function, it was really to rule out things like food poisoning. But we now have labs that focus on functional medicine and the functional aspect of how well the gut works. So we can look at your normal bacteria. We can see if you've got parasites. We can see if you have overgrowth of yeast. We can see how well you're digesting and you're absorbing your food. We can look at your pH. We can look at short-chain fatty acids, which are the byproduct of normal bacterial metabolism. So fortunately, we have several labs now that actually look at the diversity of the gut in terms of how well you're digesting your food, you're absorbing your food, and the relative balance of your gut microbiome. And now we have some other labs that are emerging that go into much more detail of actually doing genetic mapping of your gut, where it can measure all the different species of bacteria, viruses, fungi, and parasites that comprise your total microbiome. But again, I think we're just at the beginning of understanding about what a normal microbiome is. But I think this is where the future is heading, is that we're going to be able to really tie in what the gut microbiome makeup looks like now and how it correlates with chronic illness.
What should people ask their doctor for?
Reality is that they go to their regular primary care doctor, they're probably not going to get these tests done. So if someone's really interested in learning more about how their body functions and they've been to their primary care doctor, they've been to multiple specialists, and they really haven't found answers, they really want to get in the hands of either a naturopathic doctor or a functional medicine doctor that's going to be able to go down that rabbit hole a little bit deeper with them. And then they'll be able to know the right test order to look at gut function, to look at your immune function, to look beyond the surface of illness. Because, conventional medicine now is really a disease-based system. It looks for disease. It doesn't look for optimal ways to help you get well. So that's one of the advantages of working with a naturopathic or functional medicine doctor, is that they're going to be able to help you identify these root causes and really treat that underlying illness.
What toxin exposures should we be most concerned about?
Well, avoiding toxins, again, starts with education. You need to educate yourself about where these toxins are found. We know if they're putting certain chemicals in food, that may be something we can avoid. If we're eating organic, healthy food, that's going to have less toxins in it because they don't have the same level of pesticides or herbicides. Being aware of cosmetics, skincare products, shampoos, deodorants, all these things have various toxins that in small bits may not be a big deal, but if it's something you use every single day, over time your skin will absorb absorb it, it'll accumulate in your body, and that can lead to ill health effects. Again, what you put on your hair, your shampoos, your conditioners, all of these things, again, can have a cumulative effect. And the fact that we're, over 80,000 chemicals the average American is exposed to over 80,000 chemicals per year, that's a lot. And out of that 80,000 chemicals, only 200 have actually been studied for their long-term safety. So we really have no idea what happens when you get exposed to all these things over the course of decades. But we do know that our body doesn't function nearly as well because these chemicals, again, they disrupt our immune system, they disrupt our digestion, they disrupt our endocrine system, and the more chemicals we get exposed to, the harder it is for our body to function well.
How do our genes impact our ability to detox?
Our genetics are what they are. We can't change that. That's the way you were born. But the epigenetics are the expression of those genes. So just because you might have a certain genetic disposition doesn't necessarily mean that that gene's not going to work. And when we look at all the genes involved in detoxification, some people may be genetically slow detoxifiers and some people may be very, very fast detoxifiers. How well your body can get rid of toxins can definitely play a role in how well or ill you feel. So although, again, we can't really change the genetics, we can change the expression, and that's really about environmental control. So I talked about, it's about controlling diet. It's about controlling that influx of chemicals to your body through what you eat, breathe, drink, or put on your skin. As much as we can control that, we change that epigenetic expression so that you're less likely to have a negative impact if you do happen to have a genetic disposition towards a certain illness. And certainly, again, when it comes to the liver, which is involved in a lot of our detox pathways, if you're genetically disposed to being a slow detoxifier, we want to optimize that as much as possible. Fortunately, if you're a fast detoxifier, you probably handle things pretty well. But it's those people who are slow detoxifiers, and pretty much everyone I see in my practice with any kind of chronic illness tends to be a slow detoxifier. I think genetically they are disposed that they don't get rid of things quickly, so a little goes a long way, and therefore when they get that exposure over time, it impacts them in such a way that their body just doesn't function the way it's supposed to.
What are nutrients we can take to improve detoxification?
Yeah, there's certain nutrients we can use that really help improve our pathways in the liver. Things like B vitamins, vitamin B6, vitamin B5, vitamin B3, alpha lipoic acid. We know that things like magnesium also play a role. So we can use targeted nutrients to help, increase those pathways so that your body is more efficient at getting rid of those toxins, knowing that we all have that exposure.
Can you share an example of a woman you've seen as a patient when you've been able to address the root causes and help her achieve hormonal harmony?
So I have a patient named Sarah. I met Sarah, she was 26 years old, and she was tired all the time. Her body hurt. She was really barely functioning. She had a job, but she was at fear of losing that job because she wasn't able to keep up with her daily work. Well, we come to find out that she had a host of underlying health issues. She had Lyme disease, she had an underactive thyroid, and she also had a lot of emotional stress. So we started dealing with her Lyme disease. We treated her. She started working with a therapist on her emotional stress. We corrected her thyroid problem. And then we also found out that she was living on a Superfund site, which is basically toxic soup underneath where she lives. There used to be an Air Force base near where she lived, and all the toxic runoff was basically flowing underneath her home. And a lot of her health issues really started after she moved into this new home. So as part of her comprehensive plan, we started her on a detoxification protocol where we're helping improve her liver function, her kidney function, improving her lymphatic drainage. So once we started treating the underlying infection, doing the detox protocol, correcting her underlying thyroid problem, over the course of the next several months, she started to have more energy again. Her brain started to function better again. She started to be able to do more activities again. And it took about 7 or 8 months to get to a point where she really felt well again. And shortly after that, she got pregnant and she had her first child, and her first child, fortunately, was very healthy. So she was a great example of someone who kind of came into this not really understanding what her underlying health issues were, and just by identifying them and correcting them in the right way, we worked with her body instead of against her body. We didn't have to use medication. Everything was done with herbs and nutrients and diet and lifestyle, and all the things we know in naturopathic medicine really help people get well. And she did exactly that. She did what she was told, and over the course of several months she got better, and again had a very healthy child.
If you enjoyed this episode of the Woman's Doctor podcast, be sure to share it with the women in your life and rate and review the show. And to learn all about balancing your hormones, join us for the Hormones, Health, and Harmony 9-part documentary series at hormoneseries.com.